wellness revolution starts now.
Welcome to the program. My name is Bryana Gregory, a pharmacist and physician liaison with Physicians Preference Pharmacy. And today we are going to have a conversation about a compound that has been around for a long time, low-dose naltrexone. So I can't wait to dive in. We're going to do a question and answer type format here and address some questions that I often get from our guests. And you can see if you feel like this is applicable to you as well.
And there are a lot of questions about low-dose naltrexone. So let's go right into what is low-dose naltrexone?
So low-dose naltrexone is a compounded-only product. You can only get it from compounding pharmacies. And we do compound it at Physicians Preference Pharmacy, but it's been around for about 50 years. We've been using it for quite some time. And it's interesting because it helps the body to release endorphins, those feel-good hormones, the ones that are released in our body in times of pleasure and happiness, but also during pain and stress, which might seem counterintuitive, but they're released to help manage the pain and the stress so that the body doesn't feel them so abruptly.
Okay. And so what type of guest would you recommend low-dose naltrexone for?
So usually when we hear or we think about low-dose naltrexone, or LDN as we call it for short, we're usually thinking of the autoimmune patient. But even at a deeper level, that's driven by inflammation. So if we think about chronic inflammation, chronic gut inflammation, chronic skin inflammation and conditions, allergies, those with autoimmune conditions, those that also have overactive immune systems, those are the types of people that we really want to modulate or bring down or bring their immune system back into balance. Because when we take LDN orally, which is most of the dosage forms that we compound here, let's say an oral capsule, for example, LDN helps to balance the immune system by controlling inflammation. And inflammation is necessary, but what is not necessary or normal is when it's ongoing or chronic. And a lot of people experience ongoing chronic inflammation, and that is where we're trying to interject and what we're trying to control. So interestingly, LDN actually binds at these specific receptors in the body called opioid receptors. And when they bind there, they have a balancing effect on the immune system on some very specific immune system cells like T cells, B cells, natural killer cells, mast cells, which might sound like a bunch of gibberish, but basically what that is they all have a very independent role in the immune system for making sure that the body doesn't turn around and attack itself, or for creating immunity against a bacteria or a virus or something like that, and controlling inflammation. Also helping to protect against the growth of cancers. All these types of things that if our immune system is not consistently in check can happen if something goes awry. So LDN helps to kind of calm down an overactive immune system and give us our balance back.
So often people don't even realize they have some of these symptoms, right? Or inflammation or, even with autoimmune. So what are specifically the symptoms people should look for in a case where they might need low-dose naltrexone?
So I think typically most people will experience the inflammation. That's really quite obvious to most. They have trouble navigating around. They can't get up out of bed. They're fatigued. They feel like they have a lot of brain fog, a lot of pain maybe. Neuropathy or nerve pain is also a big one. But of course, if they've been already diagnosed with an autoimmune condition, then that is a surefire indicator. But just to list a few, LDN is good for a lot of different indications. But if we think about autoimmune conditions, Hashimoto's thyroiditis, which is the autoimmune component of hypothyroidism or low-functioning thyroid, that is one of the main uses that we use it for here in our guest population. Lyme disease is a big one. Celiac disease, eczema, psoriasis, multiple sclerosis was one of the first conditions that LDN was used in to see if it was going to be effective. Weight loss, pain, depression. So you can see the list goes on, and this might sound too good to be true, but if we really think about how LDN is working, these are all rooted in inflammation. So if we're addressing the inflammatory component, then we can really help to improve the symptoms of people with these conditions.
Interesting. Now, before you mentioned capsules, What other types of formulations do you compound low-dose naltrexone in?
So we have, yes, the oral capsules, which are typically easiest for people to take. They like that. It's convenient. We have the sublingual tablets that dissolve underneath the tongue. So if someone has gut issues, it might be beneficial for them to actually get full absorption in the mouth, which goes straight into the bloodstream. And then we also have topical creams. So we make naltrexone alone that is applied topically. That's really helpful for allergies or if someone is experiencing excessive inflammation directly on the skin, that gives them pretty quick resolution. We also have it present in our eczema and psoriasis formulation, which all the ingredients in there help to tame the inflammation on the skin.
Sounds like you have the full spectrum covered there. So if someone, a patient or a guest, wanted to get on low-dose naltrexone, how would they do that?
A prescription is required. Anything that does come from a compounding pharmacy will require a prescription, including LDN. So there's a pretty standard way that we start prescribing LDN in a patient, and we work the dose up slowly. However, if your prescriber is not familiar with how to do that, it is extremely easy to implement. Please have them call me directly at the pharmacy or any of our other pharmacists, and we would be happy to walk them through how to do that. It's very simple.
Okay. And that's Physician's Preference Pharmacy.
That's Physician's Preference Pharmacy.
And how do we contact Physician's Preference Pharmacy?
We can be reached at the website at physicianspreferencerx.com or at 281-828-9088. And I did want to mention that when we start dosing low-dose naltrexone in a guest, we start low and we work up slowly because we're dealing with the immune system. So typically it takes about a month for us to get to the intended dose until we decide if it's really going to work for that person or not. And then also I always encourage our guests to at least give it a good 6-month trial because even though they're likely to see benefits literally in days or weeks, especially with the inflammation, we really want to be sure that they're giving it the full 6-month trial to get to their intended dose to make a good informed decision.
Great. Okay. Very good advice.
Yeah. So if any of these symptoms that we've talked about today seem to line up with what you're experiencing, please do not hesitate to pick up the phone and, again, call myself or any of our other pharmacists at Physician's Preference Pharmacy, and it would be our privilege to serve you.
At Physician's Preference Pharmacy, we understand that the quality of your compounded medications directly affects the way you feel, which is why we believe that your pharmacy should specialize in compounding medications while also delivering extraordinary hospitality and guest service. We believe that both patients and prescribers should accept nothing less than consistency and quality from their compounding pharmacy. This is why we've implemented some of the strictest quality standards in compounding, exceeding standard requirements, achieving PCAB accreditation, which is the Pharmacy Compounding Accreditation Board, an organization that sets the highest standards in compounding pharmacy regarding the safety, cleanliness, and quality of your compounded prescriptions. Because of our commitment to complete health and wellness, we are dedicated to making your medications free of lactose, parabens, artificial sweeteners, and any unnecessary dyes, binders, or fillers present in many other medications, offering you the cleanest products possible.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.